Welcome to Cardiovascular Matters. Whether you are looking for answers for yourself or someone you love, we are here to give you the best information available. Each week, the founder of Cardiovascular Institute of the South, Dr. Craig Walker, and medical device sales veteran Terry Roberts discuss the causes, symptoms, treatment, and prevention of health-related issues stemming from cardiovascular disease. Now here's your hosts, Dr. Craig Walker and Terry Roberts.
Hey everybody, welcome back to Cardiovascular Matters. I'm here with Dr. Craig Walker, and we've got a kind of a really interesting topic today that's come up. He's seen it in his practice, and I've actually seen it in my own personal life. So, Dr. Walker, let's get started.
Great, Terry. Look forward to it.
One of the things, Dr. Walker and I was talking before the recording, and he's starting to see a lot of patients present in his clinic that have had some really impactful weight loss. And as a result of that, now they're starting to see varicose veins appear that were there previously, but because they were, I guess, covered in a layer of fat, they couldn't see them. And now they're it's prevalent. So there's medical implications to that. And we wanted to just touch on this, I guess, a newfound situation that's going on, and maybe give some thoughts and some of those findings.
Yeah, Terry. In particular, since the GLP1 agonist drugs have come out, and extreme weight loss is capable in most people able to lose 50, 60, sometimes more than 100 pounds of body weight. Many of these people ultimately have noticed that they have varicose veins in their legs. Now, those didn't just happen. Those were probably present long before, but could not be seen in the face of all of the fat tissue that was
Right.
there. Now, varicose vein is just an insufficient vein. By that, I mean there are no valves in that vein that are working properly. And these veins can cause problems, of course. In the greatest sense of a medical problem, of course, they can result in venous ulcers. And that's a big ulcer on the leg, of which I've seen some venous ulcers that were present in people for as long as 30 years before it
Right.
being healed. And it's a very expensive thing, and it really has a lot of morbidity associated with it because these can become infected, they're ugly, etc. Now, in particular of those losing weight, the very first thing they see is they see these veins that are present, and they just don't look right. And of course, they're not right. These
Right.
veins are simply causing blood flow that should be going back towards the heart to be recirculated to run right back down into the legs. And so it does impair circulation. Now, what can that do? Well, one thing that's been noted with lots of varicose veins is that people may feel a little weak when they stand up suddenly because they're simply not returning blood to the heart like they should, so the heart can't effectively pump blood to the same levels. I've mentioned the problems of venous ulceration. Occasionally, I've seen these varicose veins simply break through the skin and start bleeding. And I've had patients that have lost a substantial amount of blood. But in addition to all of those things, cosmetically, they're not something that people want. Okay, people have worked hard after this to finally get into shape. They're feeling great about themselves. The weight has come down. And they look at their legs and say, gee whiz, now I could get into a swimming suit, but I just don't look like I wanted to because I've got these
Right.
big veins popping out. Well, the good news is in today's world, that is very treatable. And in fact, with appropriate treatment, almost invariably, one can achieve the kind of cosmetic result where it may be difficult to tell that a person even ever had a procedure done or ever had a varicose vein in that area. And most of these patients, to be fair, after veins are treated, realize that they were having symptoms from it. And the
Right.
symptoms are the legs may feel heavy, they may feel paresthesias in the legs, they may notice that the lower portions of the legs are somewhat discolored. There may be restless leg syndrome at night. But all of those are vein symptoms. And a lot of times, patients who've come to me and said, Doc, my legs feel okay. It's just, I absolutely want to get rid of these varicose veins. They're a problem. Once we treat them, often they say, well, my legs feel so much better, which is interesting. Often we do not recognize what we do not know, which is not an uncommon phenomenon. But anyway, the ways that one treats these varicose veins is it is very important to make sure that the main superficial vein is closed at that point. So keep in mind, many patients say, "Well, don't you need all of those veins?" Well, the answer is no, you don't. We have redundant veins. We have more veins in our body than arteries by far. And the superficial veins of the legs typically contribute only about 5% of the venous return that's required for blood to really circulate. However, when the valves become destroyed in these veins, they may cause a lot of blood flow down to the legs, exactly the opposite of the function of a vein, because that's to simply help to remove the blood from the legs. And then they become a problem because now they're contributing more and more and more to congestion of the legs. And that's why they may cause pain. There can be pressure from inside that can cause some of the pain, but there can be a buildup of the toxins that the body makes via metabolism that simply aren't being removed to be filtered by the liver, the kidneys, to become reoxygenated at the areas of the lung. And so those are some of the issues seen. So the treatment for this is first to close the truncal veins and the major truncal veins. There are many, many veins in our body. So let me start with that.
Mhm.
But really, when we're speaking about superficial vein insufficiency, which is what causes venous varicosities, um, that there are four major veins that we're concerned about. On each leg, we have what is called the greater saphenous vein. It is a long vein. It starts at the ankle, on the inside of the ankle, and it runs all the way up to our hip, where it dumps into the deep vein. We have two of those, one on each side. It is the longest vein in the body. It's a vein that's often used for bypass surgery.
Oh, wow.
Now, behind the leg, running from about the ankle and then dumping into the popliteal vein behind the knee is the small saphenous veins. And we have two of those, one on each side. Now, there are variants. People can have accessory veins, can have other things, but really, when we're speaking, um, what is routine? Those are the four veins of importance. Now, typically, if one has these large varicosities, my first step would be to close the truncal vein, the greater saphenous or the small saphenous, if those were problematic. Now, there are different ways that we can do that. We can use heat-based therapies, or we can use uh, what we call non-tumescent or non-heat-based therapies. Now, the heat-based therapies have been around for a long time. So the first treatment for varicose veins was vein stripping. Surgeons would cut,
Yeah.
it would be a scar, they'd pull them out, it was painful, and often the veins recurred. Often they recurred. The first big steps around that were the heat-based therapies, and that would include laser. That would also include radiofrequency. And what is happening, we basically heat up a catheter which scores the vein down. Now, that is not what I like first for varicosities, and there are many reasons for that. To start with, we have nerves that accompany the major truncal veins. For the greater saphenous, there's the saphenous nerve. And if we enter that nerve, a patient can have tingling in their foot for quite some time. More importantly, with the small saphenous vein, there's the sural nerve. And if that nerve is injured, one can end up with foot drop. So
Wow.
when we're doing treatment with heat, in order to lessen any risk of tissue damage, one, we try to avoid the areas where those nerves are. But secondly, we have to give something called tumescent. Tumescent is fluid. It has a little bit anesthetic in it. It has some bicarbonate in it. It's meant to buffer, and we inject this all around the nerve, and then of course all around the vein that we're planning to treat, to where heat does not go through and injure any nerves or other tissues. Now, the problem, particularly if we're trying to treat a venous varicosity, is that does not necessarily flow into the venous varicosities. It just closes the main vein, which often feeds the other, and the other may shrink, but often does not, and it will continue to be seen. So the other therapies that we have are non-heat based. And right now, there are two predominant non-heat based. One of those is superglue. It is
Right.
it is a tool used, and it works. We certainly put dabs of glue, of a cyanoacrylate glue, which is very much what superglue is,
Right, right.
and compress the vein, and it stays shut. Once again, though, this is not running into, we're applying dots at a time. The therapy I like best if one has varicose veins is a foam-based therapy. And the reason I like foam-based therapy, we do not have to give tumescent, so it doesn't hurt. You're not injecting a lot of fluid or
Right.
all around a long segment of vein, which is painful. But in addition to that, because it's going to go wherever the blood flows, and we control that by pressure from the outside. Um, this will get into the varicose veins and often scars them down. And in fact, in closing the the major truncal vein, it has been my experience that more than half of the people with these visible varicosities notice a dramatic decrease or improvement in the way that the varicose vein looks. In fact, it may go completely away in some cases. Nonetheless, in other cases, it does not go completely away. And if that is the case, then one can do what is called stab phlebectomy. Sounds rough, but it's not painful and it's very effective. And what we do is we actually make little tiny stabs using some anesthesia and use a device that's like a crochet needle. And actually, then that we take the vein out. Now, using that and using it correctly with the little stabs that we make, this leaves no uh, permanent scar.
Right.
And so one can take the veins out and then end up with a leg that, looks like the legs we were born with,
Right, right.
without these venous varicosities. So I've seen more and more of this, and it's really interesting when one takes someone, particularly a woman who's worked very hard, she's very pleased, she's lost 80 pounds, she's been working out hard, she's
Right, right.
feeling the best she's felt in her life. She looks at her legs and she's very disappointed. When you fix this, these are some pretty appreciative people because it really is that final coup de grace that they need to achieve that goal that they were hoping for, not just feeling better,
Right,
but looking better. And what that means is feeling better about oneself. And
right.
so I think these therapies, Terry, are great. Now, many people have heard about the external application of, for instance, laser light or things. That's used not so much for venous varicosities, but for spider veins and and reticular veins. These are smaller. They're not big ropey veins the
Right,
size of
right.
my little finger. But um, even those therapies, if one is having a lot of those kinds of reticular veins and spider veins, almost always there's underlying vein insufficiency. And frankly, if one wants a good treatment with those as well, typically it is very important to treat the underlying, named superficial vein. It makes a big difference because they're the etiology or the cause of those little veins coming up. Once you've closed those, then you treat with light, then they don't come back. I mean, I'm sure
Right.
you've known many people who've gone off, and some people have gone off every few months to get another treatment of their reticular veins and spider veins, but they keep having to go back. The reason is these are continuously being fed by the underlying truncal veins. So it's very important in those cases when possible to close those trunkle veins.
That's so interesting, and it's just a kind of a new development, since I guess 2024 when GLP-1 became prevalent. And the main thing I want to emphasize is that GLP-1 did not cause this problem. Patients had this; they just didn't realize it because, again, it just wasn't visible because you know they were carrying around so much weight. So just something to be aware of. And again, we're seeing this show up in the clinic for that very reason. It's very treatable. It's very safe, and patients can get good results. And outside of just the cosmetic effect, and it has really long term positive health effects. If you've got blood pooling down there in your legs. I mean, you mentioned the term paresthesia earlier. Is that just a tingling?
Paresthesia, so whenever we speak of nerve dysfunction, we categorize it into three categories. One is anesthesia, where you can't feel at all. That's bad
Right,
because then you don't have the protective sensation that you need.
right.
One is called dysesthesias. That's where it's painful, where it really hurts, where the nerves hurt, sort of like you might get, for instance, with shingles. That would be a
Okay,
dysesthesia.
absolutely. Yeah.
Paresthesias are just unusual feelings, not necessarily pain, but they're not normal. You might feel like something's crawling on you. You might feel it tingling, but it
Right.
may not be profoundly unpleasant. And that's what occurs there. But I do want to get back to your point about the GLP-1s. These drugs have been magical. And as a cardiologist, I have taken much time to learn about these drugs because, they're actually cardiovascular drugs as well. So in diabetics, this is what has been proven, and I'll mention the one that already has the FDA indication, but semaglutide in the trials, in the SUSTAIN 6 trial, was shown to decrease major adverse cardiovascular events, which included heart attack, stroke, congestive heart attack, stroke, and cardiovascular death. It also showed benefit in congestive heart failure. Of course, it showed improved control of glucose. And it has also been shown in the FLOW trial to reduce the likelihood of diabetics going on to develop kidney failure. So these drugs are magical drugs, not just for
Right.
weight loss. I mean, in fact, they were developed for controlling diabetes, and they do a great job of that. But we were surprised to learn how well tolerated they are in non diabetics. In non diabetics, these drugs almost never cause a low blood sugar, but
Right.
they do help to get rid of appetite in a big way, and they really do profoundly influence our ability to lose weight. So these drugs are really quite magical, and they're even being evaluated in areas like like senility and other things. And so we'll see what comes of that. But I think that these drugs are going to become the standard of care in patients who present with diabetes. I don't think we're going to use the old standard of care, and so I think we're gonna see more and more of this, and frankly, in trying to treat a diabetic patient, if that diabetic patient is 100 pounds overweight, it is
Right.
very difficult to control blood sugar.
Challenging. Yeah.
Yeah, and so I really think these drugs, which have all of these positive cardiovascular effects, which were never shown with insulin, never shown with most of the early drugs, they simply control blood sugar. This is protecting the heart. That's what diabetics die of. This is protecting against stroke. That's what diabetics die of. It's protecting against kidney failure. It's stopping them from having to go on dialysis. That's one of the major complications amongst diabetics. So I do think that these are really remarkable drugs. I don't think they're all equivalent. I think that these peptides, all a peptide is, when one looks up the term peptide, it's just a sequence of amino acids. Amino acids are the building blocks of proteins, and peptides, when you put together amino acids, then you create peptides, and these peptides can then join to create proteins. That's what a peptide is. And so there are things that are normally made in our gut in general,
Right.
Other names for them, we call them incretins or other things such as that. So these are relatively normal. Now, we have different drugs. Some of these are very, very, very similar to the, um, to the peptides made in our body. Some are a little bit different, to be fair. And so I don't think they're going to all be the same as we look in the future, but I'm very excited about what these drugs mean to medicine because I think that they are going to be used more and more. I think the problems that we may see later on, like such as a cosmetic problem, I mean, most of these people are tickled pink that they have lost a lot of weight,
Right, right,
but then they look at their legs and say, "Gee whiz, I'd like to get rid of
right.
these varicose veins." And by the way, men as well as women, and so I think it's important because I really do believe that feeling good about oneself is
Right.
very important to general health.
I don't disagree. Um, you feel good, you play good.
I think that's true.
I think that's true. And, I'm glad you made those points because what I didn't want to communicate or lead the audience to or think is that, we're anti GLP-1. We are both incredibly pro GLP-1. But if you're on a weight loss journey with GLP-1 and you have varicose veins, it's just going to show you that you have them. So, that was the premise of today's message, and you should see your healthcare provider, and you can certainly get that addressed. And I really appreciate Dr. Walker's expertise on this. He has an incredible, uh, large venous practice, as well as all the other things he does in cardiovascular medicine and peripheral vascular medicine. I don't know how you keep your skin, what you do, but I really appreciate your insights today. Yeah, I'm Terry Roberts here for Dr. Craig Walker. I really appreciate y'all listening to Cardiovascular Matters. Be sure and like and follow us if you enjoy this content. Uh, you know, uh, Hit the subscription bar where you listen. That way you get notices when we drop new content. We try to drop one a month. We've been off here for a few months, but we will hopefully get back on a more consistent schedule. That's been as much my fault as Dr. Walker's. We're getting it together. We really enjoy this. So thank you very much for listening to Cardiovascular Matters.
Thanks for listening, and please subscribe, like, and share this podcast with your friends and family. Join us next week for new topics and answers with Dr. Craig Walker and Terry Roberts on Cardiovascular Matters.